Do I start with talking about the guy who is a physician's physician? Do I talk about the guy who's a mentor to students? Do I talk about the guy that is so driven by patient safety that he thinks all the time about how we can do things better? Do I tell him about the guy that's got a great sense of humor and it'll be the center of attraction for any room he goes into, not because he wants to be, because he is.
Sometimes you have the privilege of getting to know people that make your life better and make it richer. Stu Bell is one of those.
He's the gentleman's gentleman. Stu Bell is the ultimate doctor. He truly lives and breathes the values that we feel are embodied in the profession as a physician.
He's just one of the most wonderful, kind, gentle, caring people that I've ever met. You know, and he was that way with his patients, he was that way with his peers, and he's been that way as an administrator.
When he says something, everyone listens.
He's always positive, he's kind. In the darkest times, his laugh, his booming laugh, stands out.
Stu's career started out really being a fantastic internal medicine physician. Patients loved him, he was at the top of his game, and he continues to practice today. He was president of the medical staff, he was integrated in Union Memorial, and then over time it was clear that he should be and was named the chief medical officer. And not only did Stu have an impact here at Union Memorial, but he had an impact at MedStar wide.
He walks in a room and everybody sort of seems to benefit from his aura, his positive spirit and guidance.
He quietly commands attention, and people just naturally respect him because he's so smart and he speaks so eloquently.
I think of Stu as not just a friend and someone that's very much a part of this institution, but he's also known of as a doctor to the doctors.
Because we trust him, trust his judgment, trust his professional ability, and he's very caring and compassionate.
There's no greater compliment than having your colleagues trusting you to take care of themselves and their family members.
It's the ultimate sign of respect.
The role of being a teacher, mentor for graduate medical education, for the young docs who are coming up, is such a huge responsibility and honor.
If you're going to be a teacher, you have to be intrinsically unselfish. I think he's felt that this is mission for him. So Stu Bell is an educator, it's mission for him.
There are a lot of young physician leaders that he has mentored who are now chief medical officers themselves, who started under Stu Bell's wing.
I have been with Dr. Bell 36 years of my career. So I remember Dr. Bell because he was a physician at the bedside, and he was a great mentor.
He's helped so many of us forge relationships with each other.
I always look up to him. He is somebody that you can always reach out to for wisdom or for asking for help or asking for a good advice in medicine and outside medicine.
It really has been a privilege in many ways for me to work so closely with him, as he has provided, frankly, a front row seat to watching, learning, and to leading with him.
He's been such a great mentor and leader to work with, and to really see how you can bring an open and kind approach and get great results from your team.
When I learned that he's retiring, I sent him an email saying, Stu, you can't do this. We have to hold on to you. And he's like, the only reason I'm retiring is that I trust that a lot of leaders like you are going to be leading this institution. I can't say any of us can be Stu, but we're going to follow a lot of his steps.
He's grown up here and has just been responsible for so many individual careers blossoming and people, rising. He's done so much with programs that he's, sponsored and created and helped to support.
He excels at listening, communicating, and problem solving, and has helped lead us through the most significant public health crisis of our lifetime.
There is a huge advantage in the last 2.5 years if you've been at an institution for 45 years. Huge. Because what we're asking people to do is something they've never done before in their entire life. So they have to have this absolute, implicit, blind, unparalleled trust in that local leader, putting myself at risk, putting my family at risk, working hours that are unbelievable in conditions that are unheard of. And Stu was, he was the poster child for how to do it.
He was effective in working with the medical staff, in understanding their needs and conveying the needs of the institution and the needs of MedStar. And that says a lot about him, and it says a lot about how the medical staff feels about him and the trust that he has earned with them over his 45-year career.
He's one of the most genuine people you'd ever have the privilege of meeting, and he makes everybody's world better.